Hi, I'm Jen Carter of Let's Get Real. We're here today at Maroon Creek Club in Aspen, Colorado. I'm here with Dr. Altman, who is speaking to our real women. Dr. Altman, can you tell us what you do?
I am a consultative gynecologist for menopause and sexual dysfunction.
Consultative gynecologist. So what exactly does that mean?
Well, instead of having an office where I do pelvic exams and as well as teach patients, this is purely on a consultative discussion education level, and then patients will go back to their own clinician, doctor or nurse practitioner afterwards.
Okay, so no examination. I can just call you. And when I call you, what are some of the things that we would discuss?
Well, I mostly get calls from patients who are dealing with perimenopause or menopausal issues, who are trying to make decisions about whether or not to go on estrogen or hormones postmenopausally. And then over the past decade, more and more patients have been coming to me or calling about sexual difficulties. I've lost my sex drive. We just don't have sex like we used to. Well, nobody really does,
Right.
but nonetheless, there are issues that we can deal with.
So do you become a counselor of sorts in that way?
Well, for both of these, we're not only talking about my experience as a gynecologist, but really there's a lot of psychosocial cultural stuff as well. So it really branches out because both are very multidisciplinary topics where you might have a psychologist and a sociologist and an internist and a urologist. So we kind of put all of that together for them.
So we have a very diverse group of real women that are part of our group of different ages. Do you see a wide range of ages? And for a 35-year-old, I'm almost 35, like me, what would you tell me to do?
Well, first of all, I do see all ages after 35.
Okay.
In my regular gynecological practice for 30 years in Boston, it was all age groups. But really the focus here is from 35 on. What I would tell you is you don't need to see me unless you need to see me. At 35, which is the beginning of the perimenopausal transition, which is a natural transition in a woman's lifetime, and that transition ends with the final menstrual period, the menopause. So certainly it would be worthwhile for you to have the education about what to look forward to, but I suspect at 35 there's nothing that would necessitate your seeing me unless you begin to get changes in your menstrual cycling and in the kind of symptoms that one might experience perimenopausally.
Well, you certainly did give us a full education today, and you can see the full presentation or hear the full presentation on our website, and you can also visit Dr. Altman's website, which you'll see at the end of this presentation. Thank you so much for watching. Thank you, Dr. Altman, for being here.
You're
We
very
really
welcome,
appreciate
Jen.
it.
Thank you for having me.
And have an amazing day.